Good afternoon and welcome to another lunchtime learning session with the Academy of Physical Medicine. This is a new venture for me. You can probably tell if you've seen any of our broadcasts in the past that I am not in the studio today. I'm coming to you from a conference room in Birmingham because I'm attending another event there, and my guest is joining us from Cardiff University, and he is Dan Martin. Now, Dan is a physiotherapist. He was recommended to us by one of our long-term members of the Academy, an osteopath, and Dan has already mentioned to me that he had a sneaking regard for osteopaths. Perhaps he would have been one in another life. But his claim to fame is that at the moment he is doing a doctorate in posture, and that, of course, is why we've invited him on the show. So great to have you with us. Thank you for taking the time out from lecturing at Cardiff.
Yeah, thanks very much, Stephen.
I haven't given too much of your background here. I mean, you've worked a lot with sportsmen, haven't you? You've worked with Rugby League, you've worked with Rugby Union. You've certainly made contact with a lot of very famous names in rugby in your time as a physiotherapist. Tell us, what is it that got you into looking at posture specifically?
Yeah, so it happened a number of years ago. I was kind of doing a Pilates course at the time, and they're normally weekend courses. So you normally end up doing, Pilates exercise for, 2 days straight, 8 hours a day. So you definitely get, quite a lot of work going on in and around the kind of trunk area. And I came back to Cardiff after being up country somewhere. I can't remember exactly where the course was. But I remember my wife saying to me as we're walking down to the fish and chip shop, "Are you taller?" And I kind of double took at that time. I thought, "What do you mean? Are you taller?" And I thought, it got me thinking around, was the exercise that I'd kind of done over the past couple of days, had it influenced maybe posture and influenced maybe that kind of visual that I maybe looked a little bit taller after doing that.
Okay. And you're now doing a professional doctorate, aren't you, in which is involving posture. Where are you at in sort of the research into that? Presumably the data collection is all done, is it? So now you're just trying to put it together and convince people that it's valid.
Almost heading towards data collection. So my study is kind of split into 3 areas. So I've kind of got the first area, which is what I'm going to be presenting a little bit on today, around the kind of attitudes and perspectives of musculoskeletal healthcare professionals. So physiotherapists, osteopaths, and chiropractors, looking at their kind of perspectives on posture and how they kind of perceive specifically objective posture. We know that kind of posture can be a subjective variable. You kind of look at somebody and make a quick judgment, but we're talking specifically about how kind of healthcare professionals look at posture from an objective point of view. So I kind of have done a survey. So I've got the data collection. That's actually been submitted to a journal, hopefully to be published in the next few months. And after that, I will then move into kind of the next phase of my doctoral study, which is going to look more at kind of what we're going to do with this information and potentially how we can maybe objectify posture a little bit better.
Okay. Do you want to start us off then by talking us through the survey that you've conducted?
Yeah, so a couple of aims from today. We just want to kind of hopefully give the audience a little bit of kind of a flavor of the survey. So run through some key messages and look at some of the sort of perspectives around objective posture. So I think it's probably useful just to talk about the demographics of who we kind of got the survey out to. From that perspective, we had quite a high proportion of physiotherapists. My professional network was used as part of the study, so I obviously knew probably a few more physiotherapists than osteopaths and chiropractors. But interestingly, the kind of proportions relative to the professional bodies in the UK were relatively similar. So we kind of, I think in terms of this being a UK-wide sample, we kind of hit the demographics there. So I should I should just actually pull up some of my slides. I need to kind of get used to some of the tech here. That kind of shows a little bit of kind of the demographics there. I think probably one of the first things just to kind of get a little bit of an understanding on is kind of our perspective on whether posture can change. And I think it's quite interesting to know that, over 65% of the people that we surveyed thought that standing posture, and predominantly that's what we're talking about in terms of assessment, they thought that could change. And about 30% could, thought that maybe it could change. So predominantly, I think the vast majority of healthcare professionals think to a greater or lesser degree that, standing posture does change.
Right. And does that mean that the people you surveyed think that they can, I'm going to use the word force, they can force their patients into a particular posture, or just that it will adapt according to whatever the stresses and strains are on the body?
I think probably the latter. I think, it's probably more a question of, people have that understanding that maybe through everyday life, there's lots of things that maybe influence posture. It could be, how you're feeling. It could be, your work. It could be, specific activities. There's lots of things that potentially might influence posture. And I think that, the survey is kind of implying to a greater or lesser degree that healthcare professionals are acknowledging those variables influencing posture in that way.
I don't imagine you were surprised by the strength of feeling that posture either can change or might change.
No, I think we kind of expected that to be the case, but I think the key thing about this survey is that it hasn't, there hasn't been any kind of work done on perspectives of healthcare professionals across the UK, particularly across osteopathy, chiropractors and physios as a whole. And, that needed to be documented. We kind of, there is certain narratives out there that are kind of trying to move people almost away from postural assessment. And actually, one of the things that, I'm kind of, trying to do through my professional doctorate is to kind of get people to actually consider that one of the problems with postural assessment is that it hasn't been assessed very well, and a little bit like with, and we'll get on to kind of some of the modes of postural assessment, but people haven't actually done it in a very structured and validated manner. So that's kind of one of the things that hopefully by the end of my doctoral study I'll be heading towards.
One of the concerns I remember having when I finished my training as an osteopath in 2000 was that, given the wonderful textbook diagrams which show you exactly what the spinal curves should look like from anterior and sideways perspectives, and it was almost assumed that that's what you wanted to push your patients into. And I remember thinking at the time that surely can't be true for all of our patients.
Yeah, 100%. And I think, it isn't, one of those things, the research is fairly clear when you look across the breadth of research on posture, that there is not one kind of optimized posture according to the research. And again, we looked at that in terms of, I'll try and pull up that specific slide in terms of optimization. So if we kind of... so we did look at whether or not there was an optimal posture, and it was quite interesting to kind of get healthcare professionals' views on this. That is that kind of view on. I think it's the next slide. Sorry, I might have.
But even so, that's quite an interesting one that we've got up here, because yes, we're looking at asymmetries, imbalances in that last slide, which I think I would have fallen into that camp saying that sometimes, yes, you do need to address those asymmetries. Interesting that there's 13.7% said no, you don't need to address asymmetries. Categorically, they've said that.
Yeah, and I think that is, you do seem to get, that people either have this kind of, 3/4 of people look like they've got kind of this more balanced opinion on sometimes they're going to treat asymmetry, but then there are these polar kind of views that actually we're going to treat asymmetry all the time, okay, and manage that, or we're not going to deal with it at all. And again, I think, it's quite interesting to see across, we had a really big sample for this survey, so 432 participants. It does show that maybe some of the messaging that's getting out there from the literature isn't necessarily, particularly evidence-based in terms of what's going on in practice.
Yeah. Dan, we've had a couple of comments in. Vlad has said, of course, posture can change. In Vlad's experience, improving thoracic range of motion as well as mobility helps people to be able to effortlessly stand more upright with the shoulder blades further back. And it also improves their golf stroke, their performance in almost all sports. Now, Vlad, I'm absolutely certain you're right there, but I would personally have said that it's far more important that we're improving their golf stroke or whatever sport they're doing than just saying, well, your shoulder blades must be further back. And that's obviously not what Vlad is saying there. Imran has said, did you take any particular age groups, ? Children? Now, I think what we need to be clear on here is your survey is about the attitudes of professional healthcare providers to posture, not an assessment of posture in those age groups. Maybe we can talk about posture in children a bit later on if we have time. And certainly your experience is probably as great as anybody in the country, I'd have thought, based on what you're doing. So we'll come back to that. But let's get on with the flow of your slides.
Yeah, so I think just in terms of the optimal posture, this was quite interesting in terms of what was the balance. So when people are looking at posture, a little bit like what you were talking about, Stephen, around you look at something, is it optimal? Well, actually, it might depend on a number of factors. Again, there's quite different views here in terms of this optimization of posture. And actually, it did differ a little bit between the professions. So we did tend to see that some of the kind of other the osteopaths and the chiropractors felt that actually that there was potentially a bit more of a optimal posture, yes, or maybe there might be, compared to maybe some of the physiotherapists that thought there was probably less likely to be an optimal
when
posture.
You say that, can I just clarify? When you say an optimal posture, do you mean that there is a textbook diagram which is an optimal posture, or that for each individual there is an optimal posture which they might not be achieving?
That's a very interesting clarification. So I think, great question. I think we didn't clarify that in the survey. Okay, I think that's important to say. We didn't. We just, it was clinicians' view on what optimal posture was. And that might have been either of those two circumstances that you're talking about. Are they talking about their own, one single, line of Appleby, so much in front, so much behind? Or is it a question of actually, for each individual person, they have an optimized posture that they're looking to achieve? And again, we didn't quite clarify that, and that would probably be something that would probably need a little bit more teasing out, and maybe a different style of method in terms of the research.
Okay, I'll ask him if I could come on your on the examining board when you go for your doctorate, shall
I? You're welcome. You're welcome.
Sorry, let's move on.
So I think just around, again, a few of these kind of, changes around posture. Okay, so when we're looking at posture, one of the things we want to know, and we've talked about the fact that posture could change. What we wanted to know with the clinicians is, do they think that could be something that is short term, a very transient thing, it just sort of changes, maybe with a treatment, they do some treatment, you change, and then it reverts back to how it was? Or is the more long term changes that can be instilled within that individual, or potentially combinations of short and long term? And I think, again, this was quite interesting. The vast majority of clinicians, 81%, 79%, saying that, both could be in play in terms of, these changes to standing posture. And I think that does say quite a bit around, what clinicians are trying to do with patients. Sometimes they're trying to work short term, maybe. Sometimes they're trying to instill longer term changes. Now, whether or not actually those longer term changes can occur with specific adjuncts, again, needs to be investigated.
Do you have any feel for whether practitioners of any flavour, of any particular description, are measuring the long-term change? Because that's actually very hard to do in practice, isn't it? That means going back to people months after you stop treating them and trying to find out whether they're still as good as they were when you let them go.
And this is kind of where we've got to in terms of the the postural kind of assessment. What we're looking at is we're looking to see whether or not we can actually understand what clinicians are doing from a perspective, not a perspective, but what they're actually doing in practice. And specifically, we have looked at this. So we kind of got clinicians to look at whether or not the different modes that potentially they were looking at. And the vast majority of clinicians are utilizing visual estimation. Okay, so when they're kind of measuring posture, they're 74% were utilizing visual assessment alone as kind of analyzing objective posture. How accurate that is, I think the question you're alluding to, how accurate that is coming back. Well, there has been some research looking at that. So there's a guy called Kees Waldendorp. It did a systematic review on kind of the best practices for for assessment of posture, and visual assessment was found to be the best potential assessment for clinicians. However, he acknowledges the fact that actually there's very little backing for other measures, and that's potentially down to the fact that actually the other measures haven't been validated, haven't been assessed regarding reliability across the board. And I think that's according to the systematic reviews that have kind of looked at objective posture. More needs to be done around that subject.
Yeah, I was struck by the fact that by a long way, the second strongest response to that last question was, we don't measure it at all.
Yes. Yeah. And that's, again, I think some of that is coming from the narratives of research that are currently out there. And, there is definitely a narrative, people like Kieran O'Sullivan, Peter O'Sullivan, really experienced researchers, done a lot of research around the subject of objective posture, looking specifically around back pain. But they're kind of, they're talking about that link between back pain, and there is no link, according to the research, between back pain and objective posture. However, one of the things that hasn't been done is that we haven't got a clinically available research kind of way of looking at posture. And I think that's kind of hopefully where my doctorate will hopefully kind of kick in, is that I'm hoping that we'll be able to kind of get a more validated, reliable measure for objective posture that clinicians can use in the same way that, people will look at range of movement and maybe use a goniometer. They might use something that helps objectify their decision, other than, that quick visual estimation, which is the first line, which you'd use for range of movement testing similarly. But you need something, maybe, like you said earlier, Stephen, you talked about them coming back in a few months. You want to have that kind of objective assessment, to maybe go, actually, we've been doing a few things. How's your posture changed? Hopefully, as I say, we'll be able to get something together in terms of that.
For years and years, forward head posture was regarded as being associated to, if not linked to, neck pain or back pain. Is that still the case?
Yeah, there is research to suggest that forward head posture is linked to, neck pain, definitely. There's been some reviews that have come out in the past couple of years that have stipulated that. I suppose what we don't see is kind of clarity on what we need to do in terms of the management of that, and actually how much of, does change in that posture back to a kind of more normal or optimized position, does that actually influence that pain? We don't specifically know that. And I think, yes, we might see it as clinicians on a day-to-day basis. We kind of, that posture, if I change this, but actually the research backing for what we're doing there is lacking a little bit. So again, more clarity needs to be provided.
Yeah, and do you know if there's any research behind the number of patients who've got forward head posture who don't have neck pain?
I think some of the reviews that have been done, I think, have looked at that. I can't think of any in terms of the forward head posture that, don't have pain. I think there's been stuff done on adolescents. So there's been quite a lot of stuff done in terms of specifically, I think with a lot of people, involved in gaming nowadays, they're in that kind of forward head position. My kids, they're on their phone all the time in that position, and you're constantly looking at them going, actually, don't stay there for too long. And maybe it's a message around sort of when we're thinking about that forward head position, it's not a problem to stay in that position for a certain period of time, but staying there too long, like any position, potentially is not going to be helpful. So I think these long kind of static positions that people can end up in for long periods, again, are not particularly helpful. And it's about, there's lots of research going on at the moment looking at kind of wearable technology to kind of influence some of those, maybe a forward head posture, maybe some kind of lordotic posture to kind of get you out of those positions, maybe some reminders, that kind of thing. Again, there's lots of research going on around those types of things. But I think, one of the things that, I'm keen on is that we do have a better objective marker that we can refer back to in terms of our assessment, as I say, a little bit like that goniometer example.
There'll be, I imagine there'll be lots and lots of people thinking, yes, you've hit on what most people believe there, that movement is the key rather than any single static position. And gamers probably fall into the risk category there because it's so easy to get absorbed into gaming, I imagine, for hours on end and barely move. We had a couple of observations. Kerry has said, surely some of these answers, talking about what we were discussing earlier on about when posture is a problem, come down to individual patients. Kerry says she likes the old adage that if it ain't broke, don't fix it. That said, in other people, it's causing symptoms and then correction is beneficial. And I guess, so then we're down to practitioner expertise in recognizing when it is necessary to fix a problem. And Steve says whether to treat asymmetry depends on what causes it. It might be that if we help the patient manage the structure, it might be that we help the patient manage their structural asymmetry rather than try and fix the asymmetry. Interesting. Another one, a question's come in for you. Lisa has said, what's your opinion on the CHEK method? CHEK.
CHEK. Is that a treatment modality?
Well, I wasn't sure that it was. We've had people on the show before who follow check principles, but I thought it was a training principle rather than a treatment modality. Clearly not something that you're covering in your doctoral studies. So maybe we'll leave that one out. Maybe Lisa will come back and explain what she means, because again, I don't know either. But right, let's move on with your results there, Dan.
Yeah, so I think, one of the things in terms of, we're talking a little bit around the subject of pain and posture and whether or not it's linked. And I think, the clinicians did tend to predominate that pain and posture are linked. So we're kind of getting a little bit of a picture here in terms of, healthcare professionals. They're looking at maybe an individual, and they're going, actually, does that asymmetry, is it linked to that and I think that the majority thinking that potentially there is a bit of a link there. Again, this isn't a definitive in terms of, posture and, pain being linked. But interestingly, what we did see there was that chiropractors, in terms of a group, were thinking that pain is more likely to be linked and osteopaths a little bit less, whereas physios were a little bit more in the middle in terms of their opinion on that. So it was interesting to see, and what we did find through the survey is that actually some of the things were definitely profession related, in terms of these opinions. So when we looked at kind of, that specific instant, that specific, pain and posture being related, chiropractors were more likely to answer yes.
Link is an interesting word, though, isn't it? Because it doesn't imply causation.
Exactly, which is why we kind of wanted to go down that route rather than talk about causation specifically.
Yeah. Okay.
I think one of the other things around this is when we're talking about posture, and I think you mentioned earlier, Stephen, about talking about where we're going with posture and maybe is there some form of grading of posture. I think that was a consideration that we kind of looked at, and I think we were kind of keen to understand, do people want a grading of posture when they're kind of looking at it? And I've gone too far, apologies. No, maybe it's one more. No. When you can't find the slide,
it's
definitely on
infuriating,
there,
isn't it? And it gets more and more difficult.
Yeah. It's definitely on there, isn't it? Grading of posture. Now I can't see it. We did look at grading of posture anyway. I'll kind of summarize kind of some of the opinions on grading of posture. So when we looked at posture, and I think this was quite interesting amongst the professions. So physios and osteopaths were quite similar in terms of whether or not they thought grading would be useful. Okay, in terms of, you look at somebody and they're very kyphotic, very lordotic, and you kind of, right, okay, in terms of those, aspects, right, I can maybe get a number for those. Okay. Osteopaths, physios, around about 25% of osteos and physios thought that was going to be useful. Interestingly, almost 49% of the chiropractors thought that it would be useful. So again, there's a little bit of a difference in terms of how we're utilizing postural assessment and what we might want to do with it. And I think there are studies out there that have looked at grading of posture. So there's a German researcher called Ludwig who's looked at posture and come up with, he's looked at it over the past sort of 10, 15 years, looked at an adolescent population. He has done a grading scale based on postural assessment, and he's updated that across kind of a bigger sample more recently in 2023. And it's interesting, not the majority of clinicians don't think that that's going to be useful. However, if we get a better way of measuring this, then maybe clinicians will buy in a little bit more. And I think some of the things that have hindered people's kind of thoughts on posture and their ability to use postural assessment as a modality are things like ease of use. So if it's a visual assessment, then it's very simple, very quick. You can do it straight away. But as soon as you have to get a kind of angle measurer out, or you kind of have to take a photo of them, you kind of like, you're talking 10 minutes of your time or 20 minutes of your time. You're like, I ain't doing that for my patients. That's ridiculous. Whereas actually, if we could come up with a method that is very quick and easy, that is reliable, measures, is relatively low cost, these are all things that the clinicians said could be useful in terms of objective posture, then actually we might see a bit of a shift towards clinicians utilizing a more objective way of assessing posture.
I suppose, though, from the clinician's point of view, and we touched on this earlier on, it's going to be far more useful to their patient if they can say, well, here is functionally what has changed. Unless you can say there is definitive evidence that posture is linked to pain, or is causative of pain, or is linked to function. Because actually what patients want is they want to be pain-free, and they want to get better at whatever it is they're doing, whether it's sport or other things. Many of them don't really care whether their back follows an ideal, in inverted commas, postural line.
Again, that's a really, really good comment. I think in terms of, when we're looking at posture, there are some things that we look at, and a lot of patients will come and they'll say, I want a short-term fix. I want that kind of sort. And then I don't really, I'm not too bothered after that. But then maybe as we get older, we do know that, hyperkyphosis increases with age. We know that there are definitely age-related changes within the spine. And actually, some of these things from a health point of view do have significant implications. And actually, if we don't start managing those at a younger age, then, we won't actually be able to do anything in that later sphere of life. So I think, there are definitely short-term things that are probably a priority when people are coming to see you. But we also have a longer-term kind of responsibility to kind of put things in place that hopefully manage people's posture maybe in the longer term. And again, this is kind of anecdotal and not based on research, I guess. But, there is definitely some things there that I think we need to put in place as a community of musculoskeletal healthcare professionals to ensure that actually we're looking at these things in more detail. Shirley Sharman, one of the kind of, founders of kind of postural research, interestingly, she's in her late 80s now and has she's produced a kind of exercise program that's based around improving her posture, in her 80s. If she potentially, I'm sure she did do some stuff earlier on in her career, but, she was trying to, I suppose, educate people in terms of that in their latter years to maybe influence their posture in a positive manner. So, I think there's definitely work to be done around that. But hopefully, if we can get this more accurate clinical measure, then hopefully that'll make a bit of a difference.
I suppose there is a bit of a chicken and egg in this, isn't there? You can't really tell whether posture is definitely linked to something if you don't have good objective measurements of posture before and after. And Simon sent in an interesting comment here. He says, isn't the problem with grading posture that you end up pigeonholing someone and you don't see the patient as an individual? But maybe if you're only using posture as a starting point and then an outcome measure, maybe it is useful.
Yeah, I think, posture is not going to be something. Sometimes you don't want to highlight posture as a I'm doing my kind of doctorate on posture. It wouldn't be necessarily something that I'm always highlighting with all patients. You have to pick and choose your patients to kind of utilize this with. But quite a lot of patients come to see me and they'll go, oh, actually, I want to kind of improve my posture. I'm too slumped over. I've got this forward head posture. I need to do something about it. Well, you could tell them, actually, you don't need to. But actually, long term, we don't know a lot of the potential ramifications of that kind of messaging. Okay, so actually, in my kind of experience of, dealing with, spinal pain myself, I've found benefit of doing things like Pilates exercise that has had a positive effect on my spinal position, okay, in the short term. And I don't know in another 20 years whether or not it will have changed my kind of spinal posture. But I kind of feel that it definitely helps in that short term. So I think I'm going to keep it going longer term.
Yeah. I've got a question from Jonna. Jonna, you've got a Scandinavian-looking surname, so please excuse me if I'm not pronouncing your first name correctly. Jonna asks whether your comments about gaming and head posture and so on being detrimental, whether those are a personal opinion or are they backed up by evidence yet?
Again, a great question. I think that there has been studies looking at gaming and, specifically periods of time in that position. I don't know any specific papers at present. There are a couple of researchers that have looked at this, but I can't remember specifics on that. Again, I'm not looking specifically at the link between kind of spinal pain and posture in my research. So I kind of maybe am not quite as familiar with some of those articles, but I'm pretty sure there's kind of this link. Well, there is definitely a link between, the forward head posture and, spinal pain. Sort of neck pain. I think whether or not that kind of is linked specifically to gaming, I think would probably, I don't think so.
Okay, we've got 10 minutes left. Have you got more you want to cover on your survey there, Dan?
I think there's a few things around sort of the treatment side of posture. Okay, so I think one of the things we looked at was around what interventions clinicians would utilize in terms of posture. So we looked, gave them a huge list of potentials, including manual therapy, acupuncture, hydrotherapy, also exercise, education, behavioral change methods, their work style, activity profiles, different types of things that potentially might influence posture. And clinicians came back and said the three, biggest areas that they kind of would utilize, and this was across the field, was exercise as kind of number one, education as number two, and then a behavioral change strategy as kind of number three. Now, behavioral change and education, probably some people might use that interchangeably a little bit, but I kind of think that formed a relatively good understanding in terms of how clinicians are going about management of posture and what they might utilize to kind of influence that. What isn't backed up by the research is potentially what specific aspects of exercise influence posture. And again, that comes back to the fact that actually we need a clinically relevant objective postural measure that clinicians do use. And also what kind of educational strategies are being used to influence posture. So we know that clinicians are utilizing this, but we maybe don't know the specifics there. I think one interesting thing, because I'm a manual therapist, I kind of do love my manual therapy. I've probably moved a little bit more away from that after kind of moving away from professional sport, but still do manual therapy. But interestingly, the chiropractic profession a lot more likely to utilize in the treatment of posture manual therapy, around 87%, 63% of osteopaths, but only 30% of physios utilizing manual therapy. So it's interesting to see the kind of dynamics there, and when you're treating posture, quite different across the professions. And again, that was significant in terms of statistical significance for that result.
Right. A couple of questions. I think we have answered this one, but I'll bring it up anyway. Sonia and Johnny both asked whether there are any apps out there which you can use to easily assess before and afters where posture is concerned. And I think the answer to that is that there isn't anything, is there? Which is part of the point of what you're doing. Paul says, sorry, were you about to?
Yeah. So really, good question. There are apps out there. So just to kind of clarify, there are apps out there. So there's an app called Posture Screen that probably is kind of the market leader in terms of apps that look at posture. There's also one called Apex, that's an Italian-based company. There's another one, Physiomaster, a Croatian-based company, Bodiomaster, Canadian. So there's a number of players within the app field who are kind of, I suppose, in play. What isn't happening, and this is kind of where the survey hits, is actually they're not doing what the clinicians want. So they're not providing something that's easy to use. Okay, they're not providing something that's reliable and valid, and they're not providing something that is relatively non-cost. Is relatively cheap. So I think that's what clinicians want, and that's kind of why I think the uptake. So we saw 74% of people use visual assessment, but we're only seeing a relatively small number of clinicians then actually backing up what they're seeing with maybe a more objective measure. And I think there are those apps out there, but it's a question of actually are those apps doing what clinicians want more than anything else.
Okay. Robin has asked a very appropriate question here. Do you think, and this might have to be your personal opinion, but do you think improving strength and fitness is a better target than improving posture?
I think yes. I would say, according to the research, that is the case. So you should be, as clinicians, targeting strength, function, a lot more than you are targeting posture. Having said that, I think one of the things that I'm very keen on is that we just don't dispense with posture as a kind of measuring, modality. And we, I think there is a danger that actually people are moving away from this kind of understanding of posture within assessment and just focusing on things like strength and function purely without actually considering some of the aspects of posture that could be significant for the individuals that have got pain.
Yeah, and interesting. I was reflecting on what you said a few minutes ago, that you talked about how people are addressing posture, and you said, well, some are addressing it by exercise. And I don't know how you deconfound the research in this, because is changing the posture the thing that helped, or is it the exercise that helped, and just as a consequence the posture changed? Who knows?
Yeah, and I think again that needs to be researched. There's no kind of good postural measure that's kind of looked at these modalities and gone, right, okay, in a clinical setting, when we do some exercise, this posture is going to change. And obviously, when you put a research project together, you'd be able to manage some of those confounding variables. But unless you've got this measure in the first place, then you're kind of stumped.
Yeah. A couple of observations here. Paul says he comes from the perspective that optimum posture is the most energy efficient, i.e. head over pelvis. The MSK system was idling to stand with joints evenly balanced, aka easy normal. A posture is where muscles are revving just to hold a posture. Okay, I'll take that point. Mike says the evidence base is almost dependent on your interpretation of evidence. Pharmaceutical double-blind trials don't apply to Mary, the 90-year-old who has worked on a sewing machine for decades. Mary would argue her anecdotal evidence of the osteopath that she sees who has helped her with her pain. Yeah, I suppose there's so much evidence around now that we can't trust evidence, isn't there? That it makes it very difficult to know what you can believe and what you can't believe, because most of us, and you are clearly an exception, Dan, most of us can't really interpret clinical trials or other trials effectively or accurately, given the complexity, especially of the statistical analysis. And yes, it's very difficult. AI is confounding the problem even further, quite probably. But yeah, it is a problem. We've got 30 seconds or so left. We've had 449 people as part of our audience, and I'm thinking to myself that maybe a lot of them are thinking like me, Dan, that we've grown up making assumptions that posture is one thing or another, but the difficulty here is that we don't really have any objective way of measuring what we're doing easily, and we don't really know whether our beliefs are based on fact or just instinct, supposition, or what we might think of as common sense. Is that fair?
I think that's a really good synopsis, Stephen. Yeah, and I think and I think we need to get that better understanding. That's clear, and I think it is a passion of mine that I want to kind of help the kind of evidence base in terms of clinical assessment, and hopefully engage clinicians to kind of utilize a more objective way in which they can look at posture.
Dan, thank you very much for your time. And I should also thank Martin for suggesting you come on the show. I'm thinking that there's going to be some scope for getting you back on when you're further through your doctoral research. But it's been very interesting. Thank you very much for that.